Hi, I'm Varun Narayan. I had quite a few problems in my left knee, some genetic, some caused by accidents. I had a long-standing fracture. I had misaligned, knocked knees, and a bunch of other issues. I've had my MPFL repaired. I've had my kneecap realigned. I've had my entire knee realigned.
Okay, Varun, let me ask you a couple of questions. Say, what was your problem when we met?
Walking.
When I examined you?
Walking was very difficult. It was painful. Stairs, especially uphill and downhill more so, were quite painful. Could not run. Could not really hold a lot of weight on myself. And sports and everything were out of the question.
Can you remember those things that the patella was getting dislocated
Yes.
and you were wearing some sort of brace?
Yes, I was wearing a patella brace right here, and even though it helped, it never solved the issue of the pain itself.
Since what age your this patella dislocation started?
Around 12 years old,
What is your age now?
24.
24. So 12 years you were with patella dislocation.
Yes. I was told by the doctors at the time that it wasn't like nothing doing, like nothing was possible. I just have to live with it and manage it. And but it got over the course of 2022, it got very bad and very painful. And I couldn't walk normally anymore. So something had to be done about it.
So, do you remember the procedures, the name of the procedures? I'm just asking, I'll help you.
MPFL repair,
Tibial Tuberocity transfer. The patella got
TTL,
centralized. TT transfer.
TT transfer, yes.
And the alignment correction of the legs.
Yes.
And we did some cartilage procedure for it. So,
Artificial cartilage introduced.
So, how many days now this is after surgery?
About 3.5-4 months.
4 months.
Yeah.
So, what are the activities which you feel that you are able to do it now?
Right now, I'm able to walk without any pain. Stairs, no pain. If I put my foot slightly off center, it's perfectly fine. It doesn't buckle. That was another thing my knee used to do. It would just like randomly just buckle and I would like fall on my face.
So
all of that
was
stuff.
without patella dislocation,
Yes.
which is not happening right.
Yes.
So that's a great feeling. So after 12 years of pain and agony, you got the surgery done. So what is a message for other people? There are many of the patients are dealing with patella dislocation, valgus deformity, knocking knee, and a lot of cartilage defects. So they have this tendency when the doctors will tell them that there is no solution to this.
Yeah.
What do you want to give the message? What sort of message you want to give to them?
Come to Dr. Debashish, honestly.
Yeah, that's true, but
Just get it looked at. Honestly, get it looked at. There might always be a chance that it will get better because for a lot of things, I was told, like I have had thyroid issues as well. I was told it would never be fixed. Eventually, did get fixed through the right medication and lifestyle and all of that. So nothing is unfixable per se. Definitely get it looked at, and definitely get it looked at before it becomes a severe problem. Because once it gets to a certain point of damage, there's sort of no coming back. If I had waited, let's say, another 5, 6, 8 years, my knee would have been in much worse condition than it is now. It might not have even been savable. It might just have been replaced entirely. Definitely get it done in time, preferably before it's even a moderate issue, honestly.
so you have another issue which is remaining. Can you explain that on the other side?
On the right side, not as severe as the left side. There's still an alignment issue. There's still the patella dislocation and the cartilage missing, but it doesn't hurt as much. And this one does not have a fracture to fix, so it's relatively easier.
So now you are planning for the other side of it.
Absolutely.
So that's a motivation thing that once it is fixed, now you are again back with another thing that you want to book your surgery.
Absolutely.
That's, I think, most motivational thing for the patients, that once they get one side corrected, they get motivated to get the other side done on their own.
Yes.
Not me. Now I'm not going to explain what I'm going to do. Now you came with this idea that I'm going to get it fixed and corrected.
Absolutely. Yeah. I didn't want to just mess around or like just wait around now. Maybe it'll get fixed or maybe it'll get better now. I want to get it done. I know there's a path forward. I just have to work with the team.
So another thing I'm going to ask. See, past 4 months, I don't think so this is going to be a very smooth path. This was a very troublesome, painful, and
Yeah.
I think you did well. So I would definitely ask you, just say it in front of camera that what all thing happened in between.
The physiotherapy. That is that was the toughest part, I would say, physically. But in all honesty, nothing I experienced was as tough as having to use my broken knee every day for like 10, 12 years. Because that was just way worse than any of the physiotherapy, the injections at the hospital, the everything, the meds, the pain, none of it compared to not being able to function with my leg.
Do you want to say anything about your physio trainer?
Yeah, Sonam and Dr. Said, absolutely fantastic people, have helped me tremendously daily, constantly with pain management, with techniques on how to get better, on how to change my lifestyle or correct my lifestyle to not hurt my knee much, like a billion things. Absolutely, huge shout out to them.
Thanks Varun for saying it loud. I think it's a message for all of our patients who have trouble with knee pain issues
Yes.
a lot, cartilage disorder, alignment disorders, and they are actually afraid. So I think you are the right person whom the patients can talk. Do you feel comfortable talking or explaining that patient if I give your number to other patients as well?
Yeah, I'm completely open to it. Perfectly fine.
Thanks, Varun.
No problem.